right, team, we've just received a call from paramedics. We have a 50-year-old male found VSA, witness collapsed, was about 10 minutes ago, was given one shock VFib in the field, has been intubated, no EPIs have been given, and has one IV. So I just want to make sure that we have the room set up and that we have everybody that we need for the team. So we have Farah, who's going to be our CPR coach. We have Sarah, who's going to be IV and meds. Brandon, we're going to be here for our RT. Celine is going to be our documenting nurse, and then we have Carl and Stan for chest compressions. Can we just make sure we have everything else set up in the room? So we have our defibrillator with all the crash cart meds. We have a backboard. We have our airway equipment and all the medications that we would need. Farah, do you mind just quickly outlining what we do for CPR Coach?
So I'm just going to grab my card that's going to be on my Zoll here. So again, I'm Farah. I'm going to be the CPR coach with this resuscitation. So the first thing is, Sarah, if you don't mind, when the patient comes in, attaching the adapter to the EMS pad so we can get CPR feedback. We'll also just make sure that the CPR feedback device in the puck is securely on the patient so we get good CPR translation to our defib. Brandon, if you don't mind connecting the end title from the Zoll as well as the GE monitor so it's visualized in the room. And then Carl and Stan, our goal for high quality CPR and end title is going to be anything over 10. I will be referencing you to the dashboard here and providing you real-time coaching. Please let me know if you're tired. So remember, our goal is to be at a rate of 100 to 120 with a depth of 2 to 2.4 inches. And again, if you're tired or fatigued, let me know. We want to keep our elbows nice and straight over the lower half of the breastbone in between the nipple lines. Celine, you'll be documenting, so I will be doing the timing for our pulse and rhythm checks. I will be counting down at the 5 seconds as well as a 15-second warning, and I will be pre-charging. Amit, if it is a shockable rhythm, upon your instruction, I will administer the shock. And Celine, if you don't mind timing for epi every 3 to 5 minutes. Great.
Perfect. And then when the patient arrives, if you can just have 1 milligram of epi drawn before the patient gets in, we'll have the pads on, and if it's a shockable rhythm, we will do a quick pulse check, shock, and go with CPR. Sound like a plan? All right, team, can we transfer the patient over, connect the equipment, and we'll do a quick pulse and rhythm check.
Okay. Carl, I'll get you to start compression. Sarah, can you connect the adapter right away?
Yeah.
And turn the defib on, please.
Okay, 1, 2, 3, over.
Good. Continue chest compressions. Let's get the stretcher out.
Okay, team, in a second, we're going to stop for a pulse and rhythm check. Can we please pre-charge the machine?
Pre-charging. Carl, if a shock is advised, I'm going to shock and I want you to get immediately back on the chest.
Okay. Let's stop. It looks like VFib. Can we shock the patient, please?
Everyone clear? Shock delivered. Back on the chest, please.
Good. And can we give 1 milligram of epi now, please?
1 milligram of epi.
Shock delivered, 200 joules.
Push harder.
So Stan, this is your CPR dashboard. I want you to look at these numbers. You want to be between 2 to 2.5.
Okay, team, in a second, we're going to stop for a pulse and rhythm check. Can we please pre-charge the machine?
Pre-charging. Carl, if a shock is advised, I'm going to shock and I want you to get immediately back on the chest.
Okay. Let's stop.
Of epi is given.
1 milligram of epi given.
Thank you. Brandon, can we get a quick airway assessment, please?
Yeah, patient came intubated by EMS with a number 8 ETT secured at 24 at the lips. We have positive end tidal on our Zoll and on the patient monitor as well.
Thank you.
Bilateral air entry on auscultation.
Okay.
Stan, you want to push a little bit harder. Your goal is to be between 2 to 2.4 inches, and you are going a little bit too fast, so 100 to 120, okay? You'll see your end tidal here, right? We're hovering at about 8, so our goal is to be at 10, okay? Let me know if you're tired, and keep your elbows nice and straight.
Good compression.
Excellent job. All right, team, we're approaching 15 seconds. Go ahead and pre-charge. And Stan, if a shock is advised, I'm going to shock right away. And Carl, I need you to get back on the chest. Okay. 5, 4, 3, 2, 1.
Okay, it looks like VFib. Can we please shock the patient?
Okay, everyone clear? Shock delivered, back on the chest. Carl, are you able to see the dashboard here?
Yes.
Okay. So I want you to look at your metrics at the top. So you want to be between 2 to 2.4 inches, and your rate is great between 100 to 120. Okay?
Okay.
Your end tidal is at 11. Our goal is to be over 10. So great job. Let me know if you're tired. Okay?
Okay.
If we haven't given already, can we please give 300 of amio?
300 milligrams of amiodarone.
Max heart rate 1200.
Good job. So Carl, I notice your hands are just slipping off the puck. So you want to make sure that the heel of your palm is actually over the CPR feedback device. Good job. Keep going with your compressions.
300 milligrams of amiodarone is given.
300 milligrams of amiodarone.
Thank you.
So your CPR is great right now. I want you to stay within these numbers, okay? And your end tidal is 12. Let me know if you get tired.
Okay.
We are approaching 15 seconds. So I'm going to go ahead and pre-charge the machine.
Press charge.
If a shock is advised, Carl, I'm going to shock. And I want you, Stan, to get back on the chest immediately, okay?
Okay. Can you also come in for a quick ultrasound check, Garrett?
Sure.
5, 4, 3, 2, 1.
Okay, off the chest. Looks like PEA. Do we have a pulse?
No pulse.
Okay.
Garrick,
anything
you're
on the-
reaching 5 seconds.
I'm trying to get a view, but I can't really.
Okay, Garrick, you're at 10 seconds. Back on the chest, please.
Okay, and can we also give 1 milligram of epi now?
1 milligram of epi.
So Stan, remember, you want to stay between 2 to 2.4 inches, and you want your rate to be 100 to
1
120.
milligram of epi is given.
1 milligram of epi.
Thank you.
Harder.
Are you able to see okay? Our end tidal's 8, so you want to be at least at 10, okay?
Good compression.
There you go. How are you feeling, Stan?
A little bit tired.
Okay, would you like to swap out?
Yes.
Okay, so I'm going to count down from 3. Carl, are you okay to take over CPR? Okay,
Compression.
in 3, 2, 1, let's switch.
I've noticed our end tidal is rising.
Okay. We might anticipate Ross at the next pulse check. Garrett, can we just get it set up for an ultrasound to take a look at the hearts?
We're approaching our 15 seconds. I'm going to go ahead and pre-charge the machine. And if a shock is advised, Carl, I'm going to shock and I'm going to have you get immediately back on the chest. Are you okay to continue
Yes,
with
I-
compressions?
yeah.
Okay. 5, 4, 3, 2, 1.
Okay, let's stop.
I think I see some cardiac activity.
We have PEA on the monitor. Do we have a pulse?
I've got a pulse.
Perfect. Gary, do we see cardiac activity?
Yeah, I see some cardiac activity.
Okay, great. Can we get a full set of vitals, please? The blood pressure. Can we get a 12-lead ECG? Can we dump the charge on the defibrillator, please?
Yeah, offloading the charge.
Okay, do we have a blood pressure?
It's cycling.
Okay. If we can keep the hand on the pulse, and then Gary, can we keep looking at the ultrasound machine if there's any reversible causes of this PEA?
Sarah, do you mind doing the 12 lead?
Okay. I have a 12 lead here. I'm going to take a look. Looks like an anterior STEMI. Can we please activate a code STEMI? We'll take this patient to the cath lab.